This feast
We're in our day room at the garage.
has been a week in the making.
Me and my mom spearhead, and then because I roped her into doing it.
Vernita Lewis is ready for 150 people, trickling through as emergency calls allow.
But Thanksgiving is the everybody holiday. You ought to sit down and have a meal of something.
Miss V is at the center of that. She's been a Denver Health Paramedic for 23 years.
Take a minute, be thankful for whatever it is you're thankful for.
That extra minute can be hard to come by.
7 to 12 calls a day, it seems like it's the usual these days.
That's a lot.
It is a lot.
Some of those calls are taking longer because of traffic, helping people in high rises, people worried about going to the hospital out of fear of catching something else, and ERs and hospitals operating at capacity. So calls that used to take 45 minutes can take as long as an hour. Now multiply that by a department barreling towards responding to 125,000 calls this year.
There'll be times we'll be dropping off at a hospital and, dispatch will call and ask if we can turn and catch another call, and you try and get to as many people and patients as you can.
The call load has gotten sometimes so busy that you might not have that time during your shift to sort of sit down and decompress. We don't often get to sit and have an actual hot meal, or for that matter, sit and eat.
But instead of focusing on how overwhelming it can be, these paramedics are focused on how they're handling it.
Handle the stress and not let the stress handle you.
Using their downtime to celebrate their friends.
One of the reasons that I came in today.
Showing their gratitude to those who've trusted them.
I have the privilege of being invited into people's lives.
And giving thanks for a minute to be with family.
Got our health and strength and a job and family either here or at home.
In Denver, I'm Anusha Roy.
We're thankful for them. They're thankful for each other. One of the paramedics said over the last 25 years, the number of ambulances, rigs they have has more than doubled, and it's still challenging to keep pace with the number of calls.
And they're not alone. Other emergency departments like fire, they're also working to keep up with the growing city, and they're trying to better position themselves in some of the fastest growing areas so they can respond as quickly as possible.